health care.
Yes.
Medicare for all or public option? You've got your own plan, so
Yeah,
I'll let
I
you
do.
describe it here.
I do. So Medicare for all is my plan, but my plan is different than some of the other folks on the debate stage. So here's my plan. We're going to bring down costs. Everyone will be covered, including people with pre-existing conditions. I'm going to extend Medicare to also cover vision, dental, and hearing aids, which are very expensive. But a point of distinction between my plan and some of my colleagues on the debate stage is I am not going to raise middle-class taxes. And equally important, if not more important, to many people, I'm not going to take away your option to have a private plan. When I developed our plan, it was really in large part because a lot of people came up to me and said, Kamala, I'd like having a private plan, and I don't want that to be taken away, that option to be taken away. So my Medicare for All plan gives people the option while still eliminating copays and deductibles, because all said and done, you may want a private plan, but those private insurance companies have been jacking up the prices for far too long and getting away with it, and in many situations putting profit over public health. And so we're going to rein them in, but not take away your choice.
How do you pay for it? More detail. You said it would not hurt middle-class taxpayers.
Correct. So we pay for it by, there's going to be an increased tax on Wall Street around stocks and bonds and trading. But also, I have to say that in this conversation, yes, we can look at it in terms of cost, and we're going to deal with that, but we also have to look at it in terms of benefit. Back to the point of small businesses. A successful business owner knows that the measure of whether something makes sense or not is not just about what is it going to cost, but what is the return on investment. ROI. Mm-hmm. And in this case, when we're talking about investing in the public health, investing in health care for Americans, all Americans, we mutually, collectively, are going to get a greater return on the investment. Because here's the point on this. We do have Medicare for all right now. And you know where that takes place? It's in an emergency room.
Right.
And it's too expensive. It's expensive in terms of that people are receiving their medical care in a moment of crisis. So it's expensive for the emotional, much less physical health of that family, and it's expensive for taxpayers. We can do better.